This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2024. Rotator cuff tear, or RCT, a connective tissue injury occurring within the shoulder joint, can impair shoulder function, especially in the elderly population. While arthroscopic rotator cuff repair, or ARCR, is effective, postoperative rotator cuff retears are a major complication. Additionally, modifiable risk factors of rotator cuff retears that are responsive to preoperative interventions remain limited. Poor preoperative nutritional status in elderly patients may lead to poor postoperative outcomes and complications. However, the exact relationship between preoperative nutritional status and postoperative outcomes of ARCR remains unclear. To this end, orthopedic surgeons from Japan conducted a single-center retrospective study of 143 patients aged greater than or equal to 65 years with RCTs who underwent ARCR. They segregated the patients into healed and retear groups using the results of 2-year post-ARCR magnetic resonance imaging. They assessed the preoperative nutritional status using the Geriatric Nutritional Risk Index, or GNRI, and employed advanced statistical techniques to gauge the utility of GNRI as an independent risk factor of rotator cuff retears. Results indicated that the rate of retear was 20.3%. Moreover, GNRI less than 103, GNRI greater than or equal to 103 and less than 109, and GNRI greater than or equal to 109 were the 3 data-driven strata identified through stratum-specific likelihood ratio analysis. GNRI less than 103 and medial lateral tear size per millimeter were identified as independent risk factors of retear 2 years after ARCR. Notably, a 5.6-fold higher risk of retear was observed in patients with GNRI less than 103, that is, low nutritional status, compared to those with GNRI greater than or equal to 109, that is, very good nutritional status. The GNRI may be a promising tool to assess the risks of retear following ARCR, with GNRI greater than or equal to 103 indicating a good preoperative nutritional status.